On my first day of high school as a ninth grader, the history teacher was doing roll call and asked if I was Dr. Barry's daughter. And he said, your father saved my best friend's life. And the girl sitting next to me said that your father saved my mother's life. And I think at that moment, I really wanted to have such a positive and profound impact on people's lives like my father did. I chose to be a breast surgical oncologist because when a patient gets a cancer diagnosis, it's an incredibly important time for a doctor to be able to connect. This is a very special field where I get to know my patients on an emotional level and through one of the most difficult times really in the human experience. So I feel that I'm a good fit to be a surgical oncologist because I love making connections with my patients that are lifelong and not just surgical. One lesson I've learned that makes me a better doctor today is listening to my instincts. As a surgeon, oftentimes, and particularly in the operating room, we use our senses as well as our knowledge to make sure that we're doing the right thing for our patients. For example, removing a piece of tissue that just doesn't feel right, that didn't get picked up on imaging, and now turns out to be cancer. Women can expect that they'll be supported through their entire breast cancer journey. At Sharp, we pride ourselves on the multidisciplinary approach to patient care, specifically with this very sensitive and personal disease. We have a team of experts in medical oncology, radiation oncology, breast imaging, pathology, and of course, surgery. We all work in concert to treat each individual patient. As a breast surgical oncologist, my clinical practice is dedicated to the treatment of patients with breast cancer and benign breast disease. I know that through my specialized training, I can offer the very best in evidence-based medicine and evidence-based surgery. I also perform a novel procedure by rerouting the lymphatics in my breast cancer patients so that they have a decreased risk of developing lymphedema related to their breast cancer treatment. As a breast surgical oncologist, patients can see my work. Curing cancer, of course, is the very first priority, but a close second is the cosmetic outcome. I always tell my patients that the goal is to make you cancer-free, but also to make it look like I was never there. I truly think it's a privilege to be a physician. That privilege does not come from the licenses that we acquire, but rather from the privilege and the trust that our patients instill in us. And for that, I'm very, very grateful.